How do psychological factors influence the experience of the female orgasm? What is orgasmic dysfunction and how is it treated? Hello to all lovers of psychology and sexuality. Today, we will unveil the sexual curiosities of women. If you are interested in these topics, make sure to subscribe and activate the notification bell to not miss our future videos. Also, leave us comments and share your experiences in the section below. Let's get started. Psychological factors such as stress, anxiety, and emotional connection can significantly impact a woman's ability to experience orgasm. Relaxation and emotional comfort are often crucial. Orgasmic dysfunction is the persistent difficulty or inability to achieve orgasm despite adequate sexual arousal. Treatment may include sexual therapy, counseling, breathing techniques, Kegel exercises, and in some cases, prescribed medications. Penis size. Concerns about penis size are common among men, but most women consider size not to be a crucial factor in sexual satisfaction. Communication and emotional connection are often more important. Pharmacological treatment. In severe cases, doctors may prescribe medications such as antidepressants or local anesthetics to help control premature ejaculation. However, these should be used under medical supervision due to possible side effects. Physical build. Some women may find different types of physique attractive, whether slender, athletic, or with a bit of weight, depending on personal preferences. Pleasure. Without penetration, penetration is not necessary for experiencing anal pleasure. External stimulation with fingers or toys can also be pleasurable. Polyamory versus open relationships. Although often used interchangeably, polyamory involves having multiple romantic and often deep relationships, whereas open relationships may focus more on sexual exploration with other people without necessarily seeking additional romantic relationships. Pornography and mental health. Excessive pornography consumption may be related to mental health problems such as depression, anxiety, and erectile dysfunction, although causality is not always clear. Positions that promote communication. To strengthen emotional connection, some women prefer positions that facilitate verbal and nonverbal communication with their partner, such as missionary with hugs and caresses. Posture and body language. Confident posture and positive body language, such as eye contact and a smile, can be very attractive as they convey confidence and self-esteem. Pregnancy fetishism. Some people find sexual arousal in the physical and hormonal changes associated with pregnancy. This can manifest as an increased sexual interest in pregnant women. Preparation. Proper preparation, such as relaxation and the use of lubricants, can make the experience more enjoyable and comfortable. Prevention and timely treatment are crucial for controlling the spread of sexually transmitted diseases. Awareness campaigns, access to sexual and reproductive health services, and sexual education are key components of efforts to address this public health issue. Primary versus secondary anorgasmia. Primary anorgasmia refers to the inability to achieve orgasm from the onset of sexual activity, while secondary anorgasmia occurs after having previously experienced orgasms regularly. Prostate stimulation. Some men find that prostate stimulation, an erogenous zone within the rectum, can help delay ejaculation and improve their control over the sexual response. Psychological origins. Fetishes can have different psychological origins, from early childhood experiences to subconscious associations developed over time. Some studies suggest that fetishes may arise as coping mechanisms to deal with anxiety or stress. Psychology of jealousy. Jealousy is a complex emotion related to possession and competition for a partner. It can arise for various reasons, including concerns about infidelity. Refractory period. Most men experience a refractory period after orgasm, during which they cannot have another orgasm. The duration of this period varies from one man to another and tends to increase with age. Relation to pleasure. For some people, Anal sex can provide additional pleasure due to the stimulation of nerve endings in the anal area. Relationship between stress and infertility. Chronic stress can affect fertility in both men and women. Stress can impact sperm quality, ovulation, and sexual response. Relaxing positions. For some women, sexual positions that involve less physical effort, such as lying on their side or using pillows for added comfort, are more pleasurable and relaxing. Respect and consent. It is essential to respect boundaries and obtain consent from the partner during foreplay. Women should feel safe and comfortable at all times and have the freedom to stop or change the activity if they wish. Risk of infections. The risk of infections may increase with anal sex due to the presence of bacteria in the area. Using condoms can reduce this risk. Risks and injury prevention. Lack of adequate lubrication, rough penetration, or the use of inappropriate objects can increase the risk of injuries. Taking precautions is essential to avoid problems. Role of communication in sex. Open and honest communication about sexual needs, desires, and boundaries is essential for a healthy and satisfying sex life, both in committed relationships and casual encounters. Role-playing. Exploring roles during foreplay can add excitement and variety to the sexual experience, allowing women to play different characters and enjoy new erotic dynamics. Safe exploration. It's always important to practice consent, safety, and respect when exploring fetishes and sexual fantasies. This ensures that all parties involved feel comfortable and secure. Seduction games. Seduction and flirting are key components of foreplay as they increase sexual tension and anticipation, setting the stage for a more intense and satisfying sexual experience. Sense of responsibility. The ability to take on responsibilities and commitments in life, whether at work, in a relationship, or in the community, is valued. Sensory exploration. Foreplay involves a complete sensory exploration of a woman's body, stimulating not only obvious erogenous zones, but also less explored areas, such as the nape, toes, or lower back, which can be equally sensitive to touch and pleasure. Sex and aging. As people age, their sex life can continue to be satisfying. In fact, many older individuals report a more satisfying sex life compared to their youth. Sex and laughter. Laughing during sex can enhance the experience. Laughter releases endorphins, the same chemicals released during sex, which can increase pleasure and intimacy. Sex and longevity. Several studies have shown that an active sex life may be related to greater longevity. Endorphins released during sex can reduce stress and improve mood, contributing to a longer and healthier life. Sex and pregnancy. Having sexual relations during pregnancy is generally safe, unless otherwise indicated by a doctor. In fact, many couples find that their sex life improves during this period. Sex education varies widely worldwide. Some countries have comprehensive sex education programs in schools, while in others, sex education is limited or non-existent. Human sexuality is a fascinating and diverse field that never ceases to amaze us. Sexual curiosities unveil the wonderful complexity of the human experience in the intimate realm. As we explore and understand these facts, it is crucial to remember that each individual is unique in their sexual experience. Respecting and communicating with your partner are the keys to a satisfying and healthy sexual life. Sexual education and understanding are essential tools for fully embracing our sexuality.